So chronic suppurative osteomyelitis, it could originate as a separate lesion, as a new lesion, or it could also be a progression of acute lesion into a chronic lesion, right? Acute lesion, if it's persisted for less than 1 month maximum, 1 month or say 4 weeks, it is considered as acute lesion, and if it persists more than that, it's a chronic lesion. Pathophysiology and etiology will be the same as acute lesion. You can check out my acute osteomyelitis video for that. For the clinical feature, you will have larger swelling on face. This swelling sometimes so big that patient have deformed face. In this lesion, patient have mild to no pain. So if a severe pain, it's a sign of acute lesion. Acute lesion have severe pain, and in chronic lesion you have mild to no pain. Sometimes patient swelling is so large that it will lead to reduced mouth opening because it is pressurizing all the muscles and patient is not able to properly utilize his muscle. Difficulty in mastication as a continuation of mouth opening. If mouth opening is reduced, then obviously mastication will be hampered. In this patient, you will find extraoral opening. Sometimes intraoral also depends. Extraoral openings are like this is the patient face which is swollen, right? So because of this is its mandible and it's swollen because of any osteomyelitis, chronic osteomyelitis, and because of that, the pus, the suppuration will try to leak out from the extra oral lesion, extra oral cavity, right? We just try to leak out from the skin. And if you look at the patient face, you will see a small amount of opening. It is the pathway for a sinus opening, basically a pathway for removal, a pathway for pus to exudate out of the cavity. It can be intraoral. If it's intraoral, it's going to be in vestibule. The related tooth will be mobile. Corresponding tooth to the osteomyelitis will be mobile or slightly erupted. You know, it will be in erupted into the oral cavity, just like higher. It have a higher occlusal plane than the rest of the tooth. This symptom will also correspond to chronic apical abscess. These are all the symptoms you will find in chronic osteomyelitis cases. Radiographically, when you took the radiograph, you will find a larger lesion. It may or may not involve with the tooth. We both know that. We all know that, right? In CT, you will see a huge chunk of the bone is missing. This lesion is, we know that it's a radiolucent lesion, right? It's radiolucent lesion, but sometimes you will find a small amount of bone here. This bone is sequential, which is basically necrosed bone. And if you have a necrosed bone within your lesion, if you see a radiolucent lesion and in between you will find a radiopaque lesion, which is basically appear as radiopaque, then it's a direct sign of chronic osteomyelitis, and this will also determine your prognosis. If you have failed to remove the sequestrum, it will reoccur. The lesion will not heal properly. Correct? So you will have a roughened out border, right? Radiographically, for features will be same, right? With the osteomyelitis, you will have a rough or irregular border, radiolucent with radiopaque sequestrum. This will also correspond to, will make a good DD for CEOT and desmoplastic version of ameloblastoma. Check out my ameloblastoma videos. You will find out why I said that a radiopaque lesion could be a mixed lesion, could be a DD for desmoplastic ameloblastoma. You will find that in there also. It will most of the time it will correspond. It will be related to a carious tooth. Mm, most of the time, but not always. It will be above inferior alveolar nerve canal in mandible specifically. Okay? There are certain lesions which are above inferior canal. There are certain lesions which are below inferior canal. Right? If you have a radiolucent lesion below inferior canal, so that it is very less likely to be osteomyelitis and more likely to be either staphylosis or any other pathology. Okay? For the treatment, it will be same as I told you in acute lesion. The aim will be to deep to remove or debride or to incise all of the infected plus dead bone, right? Surgically remove and remove everything. If that swelling is outside, try to drain it. Intraoral drainage is more preferred than extraoral drainage because extraoral drainage will cause scar which will lead to ugly face. It is not an advantage for aesthetic reason basically. Correct. After doing all the irrigation and doing a regular packing, systemic antibiotics are advisable and some analgesics to help the patient recover it. The associated tooth are supposed to be extracted. So this is all for chronic suppurative stomatitis. We will meet again in next lecture. We are going to discuss the rest of the osteomyelitis, especially the sclerotic osteomyelitis, converging osteomyelitis in the next lecture. Thank you very much. We will meet again. Peace out.